Now, it is hard to believe that 3 months of oral minoxidil has elapsed. So, I have been taking the 2.5 mg daily dosage, which is considered low dose oral minoxidil. It is not at a dose where it's used to typically treat hypertension, because as we know, oral minoxidil is an antihypertensive, and that is what it is FDA approved for at the end of the day. And treating hair loss with it's not going to kill you. Don't be ridiculous. Although the comments that I see are ridiculous often. People typing below things like you're going to have a heart attack and it's going to kill you and you'll get cardiac lesions. Get a grip of yourself. That's not going to happen. Anyways, I had to get that out of the way because I did a video recently talking about oral versus topical and how it's more effective, but also how the rise of scaremongering is a serious issue on the online platforms such as YouTube. But anyway, cutting to the chase. So 3 months of oral minoxidil has passed. Really, these updates are now variations on a theme. I have had mainly the hair-bearing areas of the head benefit from it, which is excellent. Increased body hair in the arms, this, that, and the other. Nah, not really. The chest, the back, I have hair there anyway. I can't say I really noticed much of a difference, to be honest with you. Definitely, I shaved last night, and look at that. It's a right pain in the neck, excuse the pun. I would much prefer to not have facial hair. If you like facial hair, well, perhaps oral minoxidil is the drug for you. It has also worked on the eyebrows and the eyelashes, which again is excellent. And of course, most importantly, it has worked on the hair, on the scalp. So now the hair is cut extremely short again on the sides. But what I would say is that the difference in the hair is it feels a little bit more ropey, with more resistance to its texture compared to when I wasn't taking oral minoxidil, going back, let's say, 4 months. So that's interesting. So there's a change going on. It's doing its job. And as I was saying before, really minoxidil becomes appreciable at the 3 month mark. I responded earlier to it than that. I probably will not do these videos on oral minoxidil going forward. There is no point. I've said pretty much all that can be said so far. Everything will become repetitive and redundant after this. I might do an update, maybe at 6 months and certainly at a year, because that would be interesting. But just before I to wrap it up. So this drug, if you want to look at the side effects that I've experienced, just watch my previous videos. It's easier. I've talked about them to death. So I will just talk very briefly about the 2.5 mg. So I take daily a 2.5 mg. You can take it with or without food. The time of the day is irrelevant. Consistency is the name of the game. So taking it every day will give a benefit to you. That's what it's all about. It has a half-life of about 4 hours, but 90% of it is metabolized in the liver. So this is why it is so effective. And an actual benefit of the minoxidil in the system can actually persist for days, even though this half-life is 4 hours. Don't let that fool or dissuade you. It really does work. So I'm taking the 2.5 mg, which is on the pretty low end spectrum of low dose. Low dose oral minoxidil is anywhere up to 5 mgs. That is what the studies have shown is the most tolerable. So by reducing the negative side effects and increasing the positive effects of the drug, it's a balance. It's an equilibrium. I probably wouldn't take 5 myself. I'm pretty happy to take 2.5. I don't see the point in halving it and then taking that throughout the day. Take it as from what I see, 2.5 mgs will yield a concentration in one go that will have a very adequate effect, and this is what I've experienced on it. I take it whole, so sorry, just to show you the drug. This is it, Lonitin. This is expensive. This is the original. This is Pfizer now. So I pay here in Ireland for a 2-month supply. I'm paying about €100. So it's a bill that does add up. The plan is, of course, to take it for life, not just to take it for a couple of months or a few years, even for life, because there's health benefits to this as an antihypertensive, because as we live in the West, we are predisposed to that. And there's some other interesting studies around oral minoxidil as well, and its other potential benefits, such as, you can Google these yourself, increased blood flow to the brain, and its potential has been looked at to reduce stroke with age. So this is a very interesting drug indeed for health, as well as health of one's scalp. Now, so this is supposed by the manufacturer to be taken whole, but because it's not film coated, I really don't see how the dissolution will be terribly impacted in vivo. So look, I'm not going to go against the manufacturer at the end of the day, but I'll leave that up to you anyway. So this is it, a tablet. So I take it whole. Anytime I can follow the manufacturer's instructions, I will. Now, it's very important to say that the packaging that this comes in is the blisters. This is for tablet stability. The sign of a poor quality manufacturing process, I hate this, is when you start getting this kind of thing, and the generics, I've seen this come in a full container like that. It's exposed to moisture. People are doing ridiculous things. They're splitting tablets and putting them back into the container for weeks. They're useless. They throw them in the bin. This tablet now has gone to waste. I will throw this in the bin. I'm not going to take it in the morning, because I like to take things where the stability is completely respected, even though it's probably going to make very, very little difference having it out overnight. I don't do it at all. The issue with having minoxidil in a container like this, now this isn't minoxidil, this is another product that I don't use, it's just a prop, is it's exposed to air, and in air there's moisture. Moisture can affect tablet hardness, which is an effect on disintegration in vivo. Hydrolysis can occur of the active pharmaceutical ingredient, and all of these things can contribute to a decrease in tablet efficacy. But especially if you are splitting tablets, which I know some people are doing, and they're throwing them back into the container and leaving them there, it's useless. Throw it in the bin. So the best way to take oral minoxidil is in the blister packages. Their quality, their integrity, stability is as it should be. This comes straight off of the manufacturing line and gone through packaging, and then you're just taking it every day, bursting that blister. It's a great way to take the drug. Okay, so yeah, hopefully anyway, look, some of this content is of interest to you, and as I said, this is it with oral minoxidil. I've nothing else to say. I'll try and answer as many questions as I can, but I've really answered them all. If you've been following my previous videos, you'll see that. If you haven't been following my previous videos, well, please do. Please check them out, because I think if you're looking at this video now and you're new to it, you're clearly interested in oral minoxidil. And I have a plethora of videos going back for the last 3 months discussing it. So do check it out anyway. Yeah, so that's pretty much it. A very broad segment of my channel has been focused on this, so well, perhaps my channel is coming to an end point soon. We do have to move on with life anyway, and make these videos to give out some degree of educational content and experience, but at the end of the day, put it aside and get on with one's life. So yeah, that's I feel that's coming soon, but it's been a pleasure anyway, and thank you very much for looking at these videos, and take care now.